What is the difference between a CRNA that works W-2 versus a CRNA that works 1099? Well, in this video, I'm going to talk all about that and give you the information that you need. So definitely keep watching, because towards the end of the video, I'm going to give you some numbers in regards to salary, which is pretty cool. All right, so keep watching. My name is Christine, and welcome to a new video. It's your first time here and you want to become a CRNA or grow your CRNA career. Start now by subscribing and hitting the bell so you don't miss anything. So CRNAs it is an amazing profession. I mean, we are growing and being able to do more and more day to day, year to year, and of course it depends on the institution. You are basically, depending on the institution, you can be the sole provider, because 95% of rural America is CRNA only. There are certain states that just have CRNAs as well as hospitals. Well, there are some states you do a team approach where you work with an anesthesiologist. For example, you may have one anesthesiologist and he may supervise 4 CRNAs. And you work as a collaborative team. There are also different models of anesthesia practice, and I'm not going to get into that today, but there's a variety of ways CRNAs can work. And yes, there are CRNAs out there that work on their own and they have no one that's underneath them. So in the sense that they work alone solely, provide amazing anesthesia, and they work closely with the surgeon. So in regards to signing off and all those type of things, the surgeon will be the person that signs the record, for example. So they work by themselves solely. I mean, there are some situations where CRNAs have multiple jobs and they're bouncing around from different areas and just doing your own thing, being independent. And this allows you to really expand yourself as a CRNA. So just think about that when you're thinking about W-2 versus 1099. A lot of 1099 jobs as a CRNA, of course there are 1099 jobs where you're working in the hospital settings, but you definitely get to really grow as a sole provider of a CRNA. Now, what is W-2 versus 1099? And remember, towards the end of the video, you got to watch this whole video, because I'm going to give you some salary information, some money information. I know you want to know, so definitely keep watching this, because I'm going to definitely give you that information, no problem. So a W-2 CRNA is what it's called is you're getting a salary. So you're getting a specific salary for the year, and then some hospitals you may get benefits, you may get retirement, you might get something called CME money for continuing education, paid vacation, sick time. And there's a lot of variation in that, okay? So you're getting a specific salary and taxes are deducted by your employer. While 1099 is when you are your own business, in the sense that you may have an LLC or an S Corp and you do all of your taxes on your own. You are not gonna be really getting any retirement. You're gonna be doing that all yourself. So you're in control of that. So you're gonna be doing your own tax deductions, getting your own health insurance, retirement, managing everything on your own. And definitely the great thing about 1099 is that a lot of the things that you're spending out of pocket is a business expense, so you can lower your tax bracket and then at the end of the day make a lot more money. But it varies, because you can be a W-2 employee and make a great salary as well. Because some people like that you don't have to worry about doing any taxes, you don't have to worry about retirement or health insurance, all taken care of. While 1099, you gotta be independent. You gotta do it all on your own. So that is definitely a variation when it comes to W-2 versus 1099. And I have a video that goes more into detail in regards to that. So definitely click the link above to get all that information for you. As well as, now, when you think about traveling CRNAs, they travel across the country, or they can be in a specific area and travel, from area to area within a city, and they can be 1099, and they basically, for example, you can work a W-2 job, you work your main shift, your 40-hour shift, and maybe once a month, once a week, you go ahead and go to a facility. You can go to a dental office. You can go into an endo center. You can go to a surgery center, a GYN clinic, or an outpatient area, for example. I'm giving you some examples. And you can work one day a week and get something called 1099 pay, where you'll have your salary, yes, but then you get income of 1099 from that facility. So those are definitely options you have in front of you. There's tons of opportunities to grow and make money in anesthesia. And yes, money is important, but at the end of the day, it's about you loving what you're doing. Me, I'm an experienced CRNA and I love what I do. You know, yes, money speaks a lot, but at the end of the day, I am happy what I'm doing. I'm very fortunate to be in this career, and I'm very thankful to have amazing preceptors, clinical advisors, my director of CRNA school, you know, as well as the students I worked with, as well as the people I'm working with now. I'm so thankful to be in this practice, and I'm so thankful to continuously grow in this career. And yes, I make a good salary, but at the end of the day, it's not always about that. It's about you being happy with what you're doing. And if anesthesia is not for you, there's so many different careers in advanced practice nursing. So if you become a registered nurse, you have so much options in front of you. You can work in hospital settings, you can work in clinics, you work in teaching institutions, you can work as an educator. If you don't really like patient care, you can work in informatics, where you can work with the electronic health record or IT. You can work in business. I mean, you can do so many things. So just keep that into your mindset that yes, nursing is an amazing career and you can do patient care, which I love. I love hands-on and I love being around people. But there's some people that love nursing, you know, the idea of nursing and the career, but they want to do more the business side, maybe the administrative side or educator side. So just remind yourself that there's so much variation. You can do anything. And there, of course, I have videos on the registered nurse salary as well as the advanced practice nurse salary. So definitely check out those videos and get yourself that information that you want to know. So that's why I love nursing. And you know, CRNA, what does that mean? I'm a certified registered nurse. Love nursing. Anesthetist. So a registered nurse who has an advanced practice degree, and I provide anesthesia. And I love being a nurse. And my day-to-day life varies, you know, there's good days, bad days, but I love what I do and I wouldn't change it for the world. So let's just get back into the focus of this video, okay? So when you're thinking about that, like for example, give you an example. I have experienced both sides of the totem pole. I was a W-2 salary employee. I worked at a level 1 trauma center, and it was a very busy institution. I got a really great experience. I worked with amazing people, and there were good days and bad days, but I really got a lot of great experience. I feel I developed a really strong skill set in anesthesia practice. And yes, I had a salary. I didn't have to worry about taxes. I got, you know, health insurance. Everything was taken care of in that sense, you know. Then now I've transitioned into something called 1099. Now I have my own business. So I developed my own business where I have an LLC, and I now basically I'm an independent contractor to a facility, but I'm a full-time independent contractor. So even though you're 1099, you think I'm a temporary person, you could be either a part-time, per diem, or you could be a full-time depending on your contract that you're going to work. You can have a contract, and for example, I get my income. To get that income from that facility, and I have to do my own taxes. So I have an accountant that does all my taxes for me. And then also I have a lot of business expenses that's extracted out of my account, so it decreases my tax bracket. I do everything myself. I have full control over my retirement, full control over my health benefits, full control over long-term and short-term disability and workers' compensation, and more. And I also have full control over my vacation time. But you have to be mindful that if you do take vacation, you're not going to get paid for it, right? Because you're working an hourly basis. And you got to remember too, you may have something called guarantee, so an 8-hour guarantee or a 10-hour guarantee. So say for example, you work at a facility, and yes, you're there to work for 8 hours. But say for example, it's not busy and you work for 6 hours. You still get paid for 8 hours. So there are some positives and negatives when you think about 1099. But if you decide to say to yourself, you know what, I want a day off, or I want to go on vacation, you gotta be mindful that you're not going to get paid for that as a 1099 contractor. So now you're thinking about salary, okay? Now think about it too. When you think about W-2 versus 1099, because a W-2 employee, you may get a lower salary. It's not always the same way. It all depends on where you're working, states, rural versus urban, small versus large hospital. Remember, it's always varied. This is just tentative information. But as a W-2 employee, you're going to get paid a not as high salary in comparison to a 1099. But that's all in perspective. Because you got to remember, you're already getting everything taxed, everything's, all your benefits are included, everything's taken care of. While 1099, you may get a higher salary, an extremely higher salary, depending on where you're working. But you got to remember, you got to do your own taxes, you got to do all your benefits, you got to do all of your business expenses. Everything is, you have to do it yourself. So depending on when you're looking at the area, it pretty much comes back about the same, in regards to pay, because depending on the institution, if you're W-2, you may get better benefits with healthcare versus 1099, you got to pay a lot more out of pocket for those benefits. So I think in my mind, what I've seen, it pretty much comes out about the same. But overall, in my opinion, in my situation, I'm getting paid more as a 1099 versus W-2. But you gotta remember, when I first started, I was a brand new graduate CRNA, and I was making a certain salary, and now I have a lot of years of experience. So remember, years of experience does help you in the sense of anesthesia practice. But then again, you got to think about it too. It depends on the hospital you're working at, depending on the contract you have, because you can still be a CRNA that has experience, but getting paid like a W-2 employee. So it's definitely important to negotiate your contract and definitely making sure that you're being compensated for your hard-earned work. Because yes, you're providing amazing anesthesia and you're going to get compensated for it. But you want to make sure you're working at a facility that you're being compensated. Because as a CRNA, you are working hard. You are taking amazing care of patients. When you're in the operating room, you're not with an anesthesiologist. The anesthesiologist, for example, or you're by yourself. It all depends on the institution. But for me, I work with anesthesiologists, and I love it for me. And so I work in a hospital setting where I work with anesthesiologists, and I love anesthesiologists that I work with, as well as I love the CRNAs that I'm working with. So for me, I'm happy. And everyone's going to vary. Some people want to be sole anesthesia providers where they work alone. But for example, I work in a practice where I have anesthesiologists, and I enjoy my work setting. I enjoy having that backup. I love knowing that the CRNAs, anesthesiologists, we can bounce information off each other. So for me, I love that. So working as a team, but at the same time, I have a supervision model where I'm supervised, but that varies because now things are changing with anesthesia practice. We have a lot more autonomy. When you're in the OR and taking care of patients, it's not just you and the anesthesiologist together managing these patients. It's you. You're alone. Your anesthesiologist, for example, will come during induction, or if you have any critical situations that you need an extra hand, maybe it's a very difficult case, very difficult intubation, you will have that person come in and help guide you. But at the end of the day, it's your decision. You're the ones making these decisions on your own. You're troubleshooting, and as soon as they leave the room, you're with that patient. The surgeon is looking at you to communicate with them depending on the situation. You're the one titrating anesthetics, giving them certain medications, making sure they're having a smooth anesthetic experience. So you're all on your own. And if you need someone and you need help, you don't even have to call the anesthesiologist. You can call a CRNA and ask for advice, because at the end of the day, even though you may have 10 years of experience or 20 years of experience, there'll be situations where you have questions, and you should feel comfortable enough to be guided and ask for help, because at the end of the day, you want to provide safe anesthetic. You want to be safe, because at the end of the day, if you were in a situation being taken care of, you'd want someone to not assume, you want someone to ask if they have any questions. So you're by yourself. You're doing everything yourself. You're extubating on your own. You're intubating. You're doing everything. You're hands-on, which I love about anesthesia. You're managing them critically. So just remind yourself, as a CRNA, yes, you can be compensated, but you have a lot more autonomy and independence when you're working. Now, think about this too. As a 1099, for example, you say to yourself, you're working in a facility, a dental office, or an endo center. It's just you. There's no one else to help you. You're the one giving that patient anesthetic. If an emergency arrives, you're the one trying to troubleshoot on your own. Maybe you may have the guidance of your nurses, guidance of your surgeon or procedure doctor. So you got to remember that you're going to be all on your own, and you have to troubleshoot. There'll be situations where a patient's critically ill, something happened, they may need blood products. You have to transfer them by ambulance to a closed facility. So in my mind, you need to have some years of experience under your belt in order to be able to know the procedures to do that. But there are some people who have that really great clinical experience as a CRNA in school that they're able to graduate, work in a facility, and be their sole anesthesia providers. So that's always an opportunity to do. And maybe down the line, I might do that. But right now, I love what I'm doing. And I love the facility I'm working at. And I'm very happy where I'm at. So everyone is different. Some people are more confident to be on their own, versus some others may need a little, more of a team model. And it doesn't matter team versus not team. It's not really saying that you don't have that experience. It's just depending on the facility you're working. Maybe the facility you're working is amazing. The culture is amazing, but you kind of have to compromise. So you gotta look at it in that. So I know I went a little bit tangent, but I want to make sure I give you a well-rounded information about 1099 versus W-2. And I have lots more videos on that. As well as if you're considering becoming a travel CRNA, what to expect being a travel CRNA, because maybe you're a person that want to travel the world, travel over the country, and expand your wings. So definitely have a video on that. And travel CRNAs are making 200 plus a year salary. W-2 versus 1099, you can make that as well. But travel CRNAs make a lot more in general when you're thinking about income. So if you want to learn a little bit about that, definitely click the link above. So thank you so much for watching. And if you want to learn more about CRNAs and how to grow your CRNA career, definitely click one of the videos over here, and I'll see you in the next video.